And Jackie, one doctor I spoke with tonight says that this sort of defies everything he's accustomed to in medicine. Doctors are seeing blood clots all over the body, from the legs to the kidneys, all throughout the lungs, and even the brain.
I am seeing a higher rate of what we call venous thromboembolism, blood clots, either in the legs or in the lungs or elsewhere. And I'm encountering it way more than I would typically encounter it in a similar patient population.
Dr. Rick Pescatore is an emergency physician. He's used to seeing pretty much everything in the ER, but COVID-19 continues to offer new lessons.
Here's how blood clots work. If I get a cut, clotting is the body's natural response to stop the bleeding and form a scab. But if that happens abruptly in a vein or an artery, that can cause a blockage and be life-threatening.
We have autopsy studies now that are showing microthrombi, tiny, very small clots that are found diffusely throughout the lungs and even in the brain as well.
After Broadway actor Nick Cordero contracted COVID-19, his wife reported on social media that severe clotting required doctors to amputate his leg. A study by MIT found more than 70% of people killed by COVID-19 had clots blocking small blood vessels.
This viral infection is so intense that it not only inflames certain parts of the organ like the lung tissue, but the lung blood vessels and blood vessels throughout the body, including the kidney and the heart and the venous system in your legs and your arms. So even arterial clots can occur, which is rare to see with infections overall.
Dr. Gerard Kreiner has also been seeing more cases of blood clots at Temple University Hospital, leading him in some cases to use medication proactively.
What we will do is that we will anticoagulate people much more aggressively than we did in the past, and in some cases we'll fully anticoagulate the patient with blood thinners just to decrease the complications of clotting.
And a few symptoms of blood clots can be pain, like pain in the legs or the chest, also swelling in the arms or legs, and also look for skin discoloration if it's a reddish or bluish color. Those are just some of the symptoms and signals that you should call your doctor. Jackie.
Matt, what are certain risk factors for getting these blood clots?
Well, people who have had surgery recently, people who are being treated for cancer, and people who don't move around a lot, they are a bit more predisposed to the blood clots. Also smoking, hypertension, the list goes on. But doctors are seeing these blood clots form in people with no predisposed conditions, and that's something that they're really looking into right now, Jackie.
All right, something we'll have to watch. Matt, thank you for that.